I'm Dr. Cynthia Lopez here at the Lowell Animal Hospital, and I get to talk to you about a reverse sneeze. Reverse sneezes can be quite alarming because it seems to happen suddenly. Your pet's never had one before, and you think they're going to die because they can't catch their breath. Truth be known, don't panic, breathe, your pet will be okay. What a reverse sneeze is, it is a normal, protective, repetitive inspiratory spasm that is a mechanism of which your dog is trying to clear something from the nasopharyngeal area, which means either the nose or the back of the throat. Oftentimes, things that can set it off are pure excitement. Other things can be noxious irritants such as perfume or a scent of some sort. Dogs can get something up their nose that can set it off, a particle of dust or something like that. They can have nasal mites, which is a little parasite that lives within their nose, and when they crawl around, they tickle their nose to make them spasm. And lastly, it can be idiopathic, meaning we don't know why it happens, it just happens. Brachycephalic breeds, dogs with a short nose, can be a little bit more prone to it than other pets. I've often seen it I had a beagle, and he always had a reverse sneeze because his nose was always on the ground. What do you do about a dog that has a reverse sneeze? Be calm, give it time, and it'll pass, despite the fact that they can appear pretty violent. Other things, if it happens treatment-wise, if it happens very infrequently, we don't recommend doing anything about it and just monitoring it. If it happens more frequently, or you have multiple pets that are doing it, then I am more suspicious of something like a nasal mite, because nasal mites can be contagious from one pet to another. And so, how do you rule that out? Well, we simply treat them for a nasal mite by placing a topical medication called Revolution on their back. If we see improvement, then we recommend retreating it in 2 weeks again. And that's enough to take care of it. Lastly, if it's really severe or happening more commonly, then what we can do is put your pet under a general anesthetic and do what we call a rhinoscopy. A rhinoscopy is where we place a camera in the front of the nose. We also look at the back of the nose to see if there's any anatomic defect that is causing it, or we will also recommend doing some dental x-rays to make certain there isn't any evidence of dental disease that's causing that, such as an abscess tooth. The bottom line is that most of these are, they're not life-threatening, they don't require us to do anything, but if you do have any questions, please consult us, bring your pet in, take a video of it if you have to, if you think about it, and we can see it at that time as well. I'm going to play you a clip of a dog. It is a brachycephalic, little French bulldog, that is having an active spasm, and so you know what to look out for.